this video is kind of for new students, we wanted to ask you all what the role of your organization is for someone who is first coming into osteopathic medicine, because I remember from orientation, it felt like alphabet soup. I was like, okay, AOA and BOME, and then it's kind of confusing for new students. So,
well, just let me turn things to my friend, Dr. Robert Kane, because the first welcome that you really get into the osteopathic profession really is not only from your College of Osteopathic Medicine, but you'll have to agree, I assume, that is really from ACOM.
Well, thank you. Yeah, I think that ACOM has the opportunity to begin to work with the students before they ever set foot inside of one of our medical schools. And so one of our important roles is the transition from college, if you're a college student looking to become a physician, or from some other setting, if you're a non-traditional student, as you move into the schools themselves. So our contact starts there. And then we have the opportunity through our different councils and groups within ACOM to actually work with you as you go through your student experience. And probably one of the biggest points of contact for us is the work with the Council of Osteopathic Student Government Presidents. And so we're able through them to hopefully connect with all of the students at all of our colleges.
Very good. So, Dr. Gimple, follow-up comments about where your organization comes into play.
Well, you know, when people think about the national board, they think to tests. And nobody, let's face it, nobody really likes to take tests or likes to think about tests. But sometimes our students interact with us first in the first and second years via our website. There's a lot of resources available for students in managing stress and maintaining wellness and keeping balance. There's certainly study resources related to some of the assessments that we put together, whether it be CompSay or other tests that are more formative along the road to licensure. So that's usually our first interactions with students. We also have some interactions with student leader organizations, COSGP, SOMA, the various different organizations, and it's always great to get feedback directly from students about our assessments, our products and services.
You know, and I think we will all agree nobody likes to be assessed. But we all know that we're going to be. But you know, what I love about ACOM as well, the Choose DO program is really amazing, and we're very happy to assist in any way that the AOA can to promote the osteopathic profession to people who are considering becoming a physician. We want them to be an osteopathic physician, and I know it goes even much, much earlier than that. So we have to applaud ACOM for their efforts, and we're happy to be a good partner there. And I know that MBOME feels the same way. But what I look at all of us as doing is really promoting the distinctive practice of osteopathic medicine. You're supported by ACOM to make sure that the choice that you made to become an osteopathic physician is supported by high quality, just like your comms will provide, but ACOM will support you in that regard as well, high quality osteopathic medical education that is different than you can get anywhere else. It is distinct. And then osteopathically distinct competency assessment for licensure that measures your progress also to a certain degree through your progress through your medical education is really important too. So is it nice to be assessed? It's nice to know that there's something osteopathically distinct that's created for you to make sure that your credentials actually reflect the education you're getting through your COM and also through ACOM's great support. And I look at what the AOA is doing is somewhere in between and maybe a bit, you know, beyond being a community, a professional community when needed. You know, so what we can do, you know, is really provide opportunities like DO Day for legislative advocacy. We can do OMED, osteopathic medical education. We have our My AOA app for a community experience for everyone who's a member of the AOA, and we give AOA membership to all students for free. And we have value in that we pay for that you don't have to. And we do board certification, so it's a full continuum, and everything that you get from ACOM to MBOME and hopefully the AOA is osteopathically distinct, where you can't really find anywhere else in your professional life cycle.
And I like to look at it as a family. The osteopathic profession is a family, and we certainly welcome the new entering students this year into the profession as they kind of enter, some cases doing white coat, certainly doing orientation, getting involved in their classes and some early clinical experience, which is so kind of essential to the osteopathic medical education model. You know, back to assessment. I mean, nobody likes assessment, but what assessment does is it gives you that peace of mind. If you encounter that situation, which I remember encountering in my orientation graduation freshman year when next to me was a PhD and on the other side was an RN who had a lot of clinical experience. And I said to myself, maybe they picked the wrong guy. I mean, how am I qualified to be in this class of really smart people? And then that starts kind of the infamous phrase called imposter syndrome. Am I going to be good enough to be somebody's doctor? Well, you are, because you're attending an osteopathic medical school that meets rigorous accreditation standards. You yourself are taking rigorous licensure tests and standard tests that are universally recognized to say, yes, she has demonstrated her competency. She is going to be good enough. In fact, she's going to be better than good enough. She's going to be excellent and will be trusted by patients and communities to be somebody's doctor someday, very soon.
Congratulations on your medical student status. You're going to embark on the greatest lifelong learning in medicine in just a few months. My name is Jason Haxton. I'm here with some of our students at the Museum of Osteopathic Medicine in Kirksville, Missouri, at the founding school of osteopathy, A.T. Still University. Dr. Still was frustrated with the medicine of his time that was doing more harm, bleeding and poisoning the patients, and he came up with a patient-centered form of health care that brings each person to their best health. That was 130 years ago. Today, there are over 60 learning institution sites in 34 states with 34,000 students right now actively learning osteopathic medicine. You're part of this rich legacy where 1 in 4 people who want to be a doctor are going to go to one of our schools. You can track yourselves back through your mentors all the way back to Dr. Still, our founder. So right now, the students and I are going to give you a tour of some of our more interesting artifacts.
Hello everyone, my name is Torrin Hughes and I'm a first-year student at A.T. Still University in Kirksville, Missouri. And I'm very excited to share with you about the original School of Osteopathy. This was the first osteopathic school founded by A.T. Still in 1892. And it has grown obviously into many different schools nationwide. So it started in its humble beginnings in Kirksville, Missouri, and A.T. Still really emphasized his love and passion for medicine, hands-on medicine, and also wanted to really emphasize the women, the strong women that he had in his life. So he did include a lot of women in his first few classes, and a lot of different people from a lot of different nationalities and different backgrounds. So that was something that was really influential in how osteopathic medicine got its start. But I'm excited to show you guys the rest of the area that we have here in Kirksville. Obviously, I get to walk through this building and see it every single day that I come in school, so it's kind of cool to be able to admire the history every single day while I'm trying to learn to become a future doctor and help people in need. So I'm glad that you guys get to see this, and I hope you guys like the rest of the video.
Hello everyone, class of 2026, welcome. I'm student Dr. Ali Detario. I am a second-year medical student here at A.T. Still. Coming into medicine, I have a little bit of a different journey going into it. I'm a first-generation immigrant from the Philippines. I was a nurse for 6 years. I was actually working as an ER nurse when I got the call for acceptance at A.T. Still, so that was a thrilling time. What we have here is the dissector that we have made here in school back in 1925. One of the first things that struck me about it as an aspiring surgeon is how detailed the nervous system is and how awesome it is and how little things kind of make the whole human body. So it looks challenging right now and there's so many details as you can see, but by the time you finish first year of medical school, I promise you're gonna know the majority of all these nerves. So it's going to be a lot of hard work, but it's going to be exciting and it's going to be thrilling to learn about medicine.
Congratulations on beginning your medical education journey. My name is Christopher Thorndal. I'm a third-year medical student at A.T. Still University. I'm pursuing a career in pediatric oncology. I'm also a recipient of the HPSP Armed Service Scholarship. Osteopathic medicine and the armed services have a rich history dating back all the way to our founder, Andrew Taylor Still, who served the wounded in the Civil War. From field medicine to in the surgery room, osteopathic physicians have been working with the armed forces throughout all of our wars. They've been decorated service members as well as commissioned officers. Whether you are going to be serving in your community or serving your country, I'm excited for you and thank you for beginning this journey.
Hi, my name is Kathleen Helgett and I am an upcoming OMM fellow. I currently call Houston, Texas home as I am a military child. As A.T. Still once said, anyone can find disease, but it is the goal of medicine to find health. With osteopathic manipulative medicine, we are able to do just that. As an aspiring neonatologist, we can also use OMM in a variety of clinical settings. From the young to the old, we can treat and diagnose a variety of medical conditions with just our hands. I hope you love OMM as much as I do, and good luck on your journey.
I want to thank our students for giving me a tour of our exhibits here at the Museum of Osteopathic Medicine. There's a lot more to see, so you can go on the internet and look us up. We're the only museum of your profession, and hopefully you'll get a chance to come to Kirksville someday and experience your roots. Good journey to you in medicine.
Hello again. My name is John Gimple. I'm an osteopathic family physician and president and CEO of the NBOME, your national board. The NBOME administers, among other things, the COMLEX USA exam series, which is an important credential for you when you one day soon go to apply for a license to practice osteopathic medicine. COMLEX USA is accepted in all 50 states and even in some international jurisdictions, and is designed to align with the training and education you'll receive during your next 4 years and beyond. Our three organizations, the AOA, ACOM, and the NBOME, understand how stressful these first few months can be, because many of us have been right where you are. For its part, the NBOME has provided many resources that can help you through these formative years. One area of our website is the Road to DO Licensure, which includes stories from the road, filled with first-hand experiences of DO students and residents who have traveled the same path you are about to. We've also asked some of your DO student and resident colleagues to share their own experiences as first-year DO students. They've been where you are and have shared some incredibly useful tips that help them navigate the transition into osteopathic medical school. Congratulations on your acceptance and choosing osteopathic medicine, and best of luck over the next 4 years. The time will fly by, and we all look forward to the exciting day where you transition into residency training and beyond into communities around the world.
Hi, my name is Brittany, and I attend Michigan State University College of Osteopathic Medicine.
Hello, everybody. This is student Dr. Marwan Faraj.
My name is Aline Gregosian, and I'm currently doing a fellowship in critical care medicine.
Hello, I'm Nicholas Harold, the 2021 to 2022 National President for the Student Osteopathic Medical Association.
Hey everybody, I just wanted to let you know, my experience in medical school, it was up and down. I think I had a lot of moments where I just had to learn how to balance my mental health, learn how to balance school, learn how to balance family. It's all about balance.
My first year of medical school, like many other students, was a whirlwind of excitement, struggles, and growth.
When you first start medical school, you kind of have to restart building your resume and your career again. And in a lot of ways, you feel like a small fish in a bigger pond, and it can be very intimidating.
Your first year of med school is going to be tough but gratifying. You're going to see that your hard work pays off and that you're not alone in your struggles and your fears. One thing I wish I knew before med school was how fast it was all going to go. You come in and meet all these incredible people, from sanitation workers to your classmates all the way up to the dean, and next thing you know, you're off to rotations.
I wish I had known before medical school that you should never be comparing yourself to anyone else.
And I wish someone had told me that it's going to take a while to figure out your study schedule and how exactly it's going to be for you to study.
Everyone does things differently, and that's because we all learn differently. And because you're not doing it the way one person does doesn't mean you're doing it wrong. You are doing something that's better for your learning style, and that is A-okay.
Entering school, I wish I knew just how fluid the process of learning to be a med student is. My advice for managing stress and anxiety of med school is to use resources available to you, to create a social support structure, and to be honest with yourself and others when you need help.
So the more you listen to your body, the more you listen to what it's trying to tell you, then you'll be able to navigate medical school. You'll be able to navigate what you need and what you need to do to be successful.
If I had to give you advice about managing stress and anxiety, I would say please continue to do the things that you enjoy and stay close to your friends and your family.
It's important to realize that you go at your own pace, and it's not as important to compete with other people. And it'll all pay off one day.
And for me personally, the way I've dealt with that is with cooking and baking. We have to eat, so you might as well prepare your own food and know what goes into it. And it's a very meaningful way to take a 30-minute break.
And especially on days that you're struggling, shoot for progress, not perfection. Set the bar low. So what that means is, instead of not opening up the PowerPoint at all, maybe you only read 3 slides. Instead of not working out at all, maybe you just take a 5-minute walk. Instead of not doing this 30-minute meditation, maybe you just stop and take a moment to breathe. All right, good luck, everybody.
So good luck, everyone. I know you've got this.
Good luck, everybody.
Good luck, student doctors. You'll be at graduation before you know it.
Hello, I'm Nicholas Harrell, an internal medicine resident, recent NYT Com at ASU graduate, and the immediate past president to the Student Osteopathic Medical Association. While in medical school, I had impactful experiences within health policy and student advocacy and leadership. Through my school, State Osteopathic Association, the Student Osteopathic Medical Association, and the American Osteopathic Association. Student leadership and advocacy comes with many challenges. One, you are drinking from what seems to be an endless fire hydrant of medical knowledge. Two, you were met with the enormous responsibility of advocating for your peers, community, and profession. However, despite these challenges, becoming involved with leadership and advocacy at your local, state, or national level will help you attain, or perhaps even further improve, skills and a knowledge base that will assist you in your caring for patient populations and with providing stewardship to the osteopathic profession. Concerning the latter, students have an invaluable role in stewardship of the profession. That can come in many forms. It can be actively seeking mentorship from osteopathic physicians, your involvement in student groups that place emphasis on student-centered initiatives, or even participation in professional development programming. So, how can someone who is interested in student advocacy or leadership get involved? There are some pretty easy ways. You can volunteer to help support or lead community-based initiatives, like volunteering at food pantries, providing community health education, or by becoming involved with student groups such as the Student Osteopathic Medical Association. You can also reach out to nonprofits, volunteer to help policymakers at City Council, or become involved with your state Osteopathic Medical Association. There are also national advocacy and programming opportunities you can attend by signing up for the annual AOA DO Day, or OMED, to premier osteopathic events within our community. My message to students is that you are the future of this profession. Your identity as a physician, patient advocate, and leader begins on your first day in medical school. Investing in yourself through medical education, leadership, and advocacy opportunities is investing directly into this great profession you will soon be joining. Congratulations on making it this far in your journey, and good luck with your studies. You will be at the finish line before you know it.
DO Proud is a phrase that began as a social media hashtag during the beginning of my medical school career, but over this time it has grown to mean so much more. Although medical school is a time for learning and absorbing as much information as possible, it is also a time for professional growth and finding your place in the career path you selected. Osteopathic medicine is an incredible field where the idea of a mind, body, and spirit approach to patient care meets traditional medicine. Entering this field from a prior career as a registered dietitian, this unique intersection between a holistic care approach and medicine was the perfect fit for me. This distinction is just one of the many reasons that DO Proud has become an integral part of my life. Involvement in medical school and finding your place within your future professional community is an important part of your success as a future osteopathic physician. At the beginning of my medical school career, I knew from day one I wanted the Student Osteopathic Medical Association, my local state society, and the American Osteopathic Association to be an integral part of my medical school career. As I previously mentioned, prior to medical school, I spent a few years working as a registered dietitian in the state of Michigan. During this time, a group called the Freedom of Healthcare Coalition presented legislation to Michigan voters stating that it would provide them the freedom to choose any nutrition provider when they received a referral from a physician. Because of how it was presented, the bill passed, but it had unintended consequences. RDs lost licensure in the state of Michigan. Starting medical school, I vowed to make sure legislation would never negatively impact my profession or future patient population again. Both SOMA and the AOA have created excellent avenues for advocacy and involvement throughout my time as a medical student. Through SOMA, I have had the opportunity to create and pass policy impacting medical students and creating positive change for the future of osteopathic profession. Additionally, I've had the chance to meet osteopathic medical students from around the country, network with osteopathic physicians, and create lifelong friends and partnerships in the process. Through my involvement with the AOA, I just recently traveled to Washington, D.C. to join my fellow medical student and future physician colleagues from around the country to advocate on Capitol Hill for positive change for medicine as a whole, our future patients at DO Day 2022. Additionally, the SOMA and OMED 2022 conference is coming up this fall, and I cannot wait to join this event for the first time in person during my medical school career. This event offers mentorship and networking opportunities that will promote lifelong professional growth as an osteopathic physician. It is events like these that have helped to shape my medical student career beyond the bounds of a classroom education. Advocating alongside these colleagues, amplifying the osteopathic medical student voice, and collaborating to create impactful health policy are another piece of the new meaning DO Proud has taken on in my life. Overall, as I embark into the beginning of my fourth and final year as an osteopathic medical student, I look back positively on all of these opportunities that have helped to shape my career path. I encourage each of you as students to get involved in SOMA, the AOA, and events like DO Day and OMED, and find what makes you DO proud. There's incredible meaning in this career path beyond the bounds of traditional medicine. Take advantage of the mentorship, advocacy, and opportunities to get involved. Your time as a medical student will only be better for it.